I am Dr. Andy Patil, practicing as consultant ophthalmologist in Nagpur as New Vision Eye Care Center. Globally, the World Health Organization estimates 285 million people having the visual impairment, and out of this 39 million people, they are blind. 1 out of 3 blind people in the world, they live in India, and 80% of this blind people is preventable and treatable. Common causes of blindness is cataract, refractive error, glaucoma, age-related macular degeneration, and diabetic retinopathy. 13th October has been observed as World Sight Day to make the people aware of the various conditions responsible for blindness in the world. And it is an endeavor to work together more strongly to achieve universal eye health. The regular health checkup and screening is a must, most important as the age advances. And there are many more situations and conditions which can be uncovered or detected while examining the eye, like hypertension, diabetes, high cholesterol level. As you grow old, you need to be aware of those eye conditions which can cause loss of vision, because many more conditions are there having no symptoms, and like glaucoma, and that can only be detected if you do regular eye examinations. Cataract is the most common condition which is responsible for low vision or visual impairment, or that is causing blurring of vision. If not treated, can cause blindness. And hence it is always necessary to examine the patient whenever he is complaining of blurring of vision, fading of colors, not able to drive the vehicle in the night, and facing other kind of problems, and not able to carry on his her own routine work. This is due to the whitening or clouding of the clear lens in the normal eye. As the age advances, it's an aging process which can cause cataract. And the situation is glaucoma. Glaucoma is known as the silent thief of sight. It can only be detected by routine eye examination. It is usually the primary open angle glaucoma or chronic simple glaucoma, which is only detectable after examination of a patient whose age is 40 plus or having his family history of having glaucoma. And to detect glaucoma, it is very simple and easy. There are only few tests in routine examination, like taking the intraocular pressure, seeing the disc, fundus, and visual field. These 3 things are very essential to detect the glaucoma, and glaucoma can very easily be preventable if the intraocular pressure is controlled in a proper way. Third is the age-related macular degeneration. As the age advances, up to after the age of 60, there are certain changes in the seeing part of the retina, in the rods and cones, or the seeing area, that is macula, and these changes, which are degenerative changes responsible for the loss of central vision. Central vision, which is most important, and whatever we are seeing through the macula is we are narrating it to the taking this message to the brain, and brain interprets rest of the things. But if the macula is damaged, this cannot be treated properly. This cannot be, if it is advanced, cannot be treated properly. And today it is very easily controlled, and further loss of vision can be prevented. This age-related macular degeneration is only in the elderly population. The diabetic retinopathy, since India is having the epidemic of diabetes, we can say the epidemic of diabetes, and mainly causes damage to the blood vessels and of the retina, leading to the extravasation of the fluid, cholesterol, lipid in the eye, and the swelling of the macula, which causes visual impairment. And if not treated properly, then again the loss of vision will be profound and will be very difficult to treat. Nowadays, the laser, the intravitreal injections are very much helpful in reducing the macular edema and treating the diabetic retinopathy. For early detection and treatment of such age-related conditions, the annual eye checkup is very simple, low risk, low stress way to deal with the eye problems at that particular age, and overall eye health can be treated and prevented. And so, schedule an appointment with your eye doctor for getting your eyes checked to rule out the possibility of all these diseases. Who should get an eye examination, and at various age, how to schedule the eye examination? 80% of the vision develops within 6 months, and if there is any problem noticed by the mother, then the child should be examined by the ophthalmologist. And babies having some whiteness in the eye, or any squinting, or any ptosis, or the not able to open the eye, should be examined before going to school. And the school going children, just before the class 1 or in the KG, they should be examined regularly for refractive error. Adults who have undergone the LASIK surgery, they should also get their eyes examined regularly. And the elderly people, they should get their eye examined whenever they are going for presbyopic glasses after the age of 40 years, to rule out the possibility of cataract, glaucoma, age-related macular degeneration. And those people who are having diabetic people should get their eyes examined with dilated pupils every year. And if they are having any diabetic retinopathy changes, every 3 monthly should be examined, because they may need laser treatment or injections in the eye. And those people who are wearing contact lenses, every 6 monthly, or whenever they are having any irritation or blurring of vision while using the contact lenses, they should also be examined. This is the regular schedule of the people at various age group to get their eyes examined. Thank you very much.